Sooner or later, most of us will need to have that confronting conversation. Is it time to move mum, dad, or grandparents into long-term care? By 2030, there will be 1.4 billion people aged 60 years and over worldwide. The world is aging really fast, and many of us are quietly worrying about our parents, grandparents, relatives, maybe even our own futures. Yet aged and elder care still feels really scary, confusing, and maybe even a bit taboo. In this episode, we're going behind the headlines to talk about what aged care really is like, where the system is struggling, and where innovation is making a difference. My guest is Fiona Symons, a lawyer to nurse and the co-founder of Care Window. You'll hear Fiona's unconventional journey, how nurses are actually the backbone of hospitals and aged care homes, and what really happens when families decide it's time for long-term care. We dive into the invisible and emotional labor of nursing, what social isolation looks like on the ground, and the practical insights on home care, assisted living, and residential aged care. Thank you so much for the CSIRO on Innovation program for sponsoring this important conversation. We love our sponsors. My name is Lucy Lin, and today's Emerging Tech Unpacked episode will be an emotional one. Stay with us as we explore how tech innovation and human compassion can reshape loneliness and aged and elder care. Welcome to the Emerging Tech Unpacked podcast. My name is Lucy Lin, and today we're talking about aged care with Fiona Symons, co-founder of Care Window and a registered nurse. Welcome to Emerging Tech Unpacked, Fiona.
Hi, how you doing?
So, Fiona, we were having a chat, and I would love to learn something fun about yourself because you've got quite a number of cool little facts. But let's start off with something that is the most funnest, if that's the word.
Oh, plenty of fun things, but I reckon we'll go with this. I'm gonna be a bit of a walking jukebox. So on top of everything else I do in life, you'll often find me just dancing down the hallway singing. I can turn anything into a music quote. I'll try not to do that on this, but we'll see how we go.
Well,
Break out the song.
If you need to get up and dance and sing, I'm sure we'll be more than happy to have that too.
Just a little random dance break. No, I'll try not to. But I am known for sprouting any kind of music at any time.
What's your go-to song?
Weirdly enough, plenty of songs about being happy. We do it at work a lot with all the residents.
Oh,
So
very good. Oh, I love happy songs. I think that gets you into the mood, doesn't it? So
pretty much.
So, like many of my guests that we've had on the podcast so far, you've had a very unconventional career path. And I know that you studied law first and then you made the switch to nursing. So I'd love to hear, why did you start with law and then what made you go into nursing? And what about this change of career? How did that happen as well?
Oh, I think like many people coming out of high school, you pick one of two angles, don't you? You either go law or medicine. And I went with law. I quite enjoyed it for a long time. I was always the legal studies person in high school and went off and actually did my Bachelor of Law, my graduate diploma in legal practice, and then eventually a master's in law. Got admitted to the court as a barrister and solicitor, did the whole pathway. And then at age 26, my marriage fell apart and I had to decide what I wanted to do from then out. So my ex is also a lawyer. We're very typical lawyers at that point in time. Law is very incestual. Everyone knows everybody. Most lawyers are married to lawyers or people who work in the profession. And for me, it was a matter of everywhere I went, all of our circles, everyone knew me and knew him. And I decided I needed to get a clean break, start my life over. And I remember thinking back to a second year lecture we had. So very start of second year law. They get someone out in front of everybody to go, congratulations, you made it to second year. Of the 300 of you who started, there's 180 left. And we all went, oh, as we looked around and realized he was correct. And then they went on to tell us, but don't worry, only 80 of you will graduate.
Wow.
Went, oh, hang on. Yes. And of that 80, maybe 20 of you will practice law. And we went, hang on, we've just spent a whole year learning the law, all excited to be little lawyers going forward. And it's kind of telling us that only 20 of us will practice. This is kind of like a hit home moment. But then they went on to tell us about how, don't worry, the other 60 of you who do graduate, who don't practice, Here's all the things you can do with a law degree. Here's all the places your previous graduates from this law school have gone. And it kind of made you think, like at 26, looking back, going, I need to change my life. Oh, wait, my law school, my law degrees, my experience is not wasted. I can actually do so much with that. What do I want to do? The world is my oyster because I've got a law degree. I've got all this kind of training and the highest level education you can get. What do I want to do with it? So natural pathway. I had wanted to be in medicine or law. I thought being a lawyer and a doctor was showing off. So I went back and got into nursing, got into aged care to start with. So I started from the ground up. I've worked my way up to registered nurse. I started as a carer in aged care, rebuilding my life with my kids as a single mum at the time. Studied my aged care certificate when I worked at aged care for a number of years. Worked full-time in aged care whilst studying full-time nursing. When I did my graduate placement in nursing, I've done postgraduate education now in registered nursing. I'm now an intensive care qualified nurse and recently promoted to ANUM, which is an acting manager within the unit. So assistant to the main managers, and I'm now a data manager there as well. So I've managed to use my law experience and education that I've had there to make my way up the chain in nursing because I bring that additional experience behind me, which is really pretty fun. But essentially it all boils down to I had to change my life. What better way than nursing and remembering an old lecture from when I was like 19 and realizing that, I've just spent a year and you telling us 20 people will be lawyers, knowing that it's okay to pivot.
That is such a cool story. I love that. And it's actually really responsible, I think, for the lecturers to also tell you that. Actually, an ex-boyfriend of mine was an engineer and they told him the same thing. They said basically 1 in 3 engineers will become an engineer and everybody else, 2/3 won't be an engineer, even though, you study engineering. So I think, professions like law, like engineering, very similar. Like, it's difficult degree and, it's 4 years, 5 years or so. And then how are you supposed to know from 18 years old, right? That's what you want to do. And then until you go into the
conversation I have with my kids now.
Yeah.
And conversation.
Yeah. And until you go into that studies and you go, maybe this is not what I actually would like to do. So I actually think it's actually quite responsible for the lecturers for saying that and for you to kind of it sounds like this is a very personal choice as well from what happened to you. But I'd love to hear, was there a lot of skills overlapped between, what you studied in law and what you're doing now in nursing?
Because I get that all the time, actually, out on the floor. I get people go, hang on, you're a lawyer? What? Why are you here? And I've had years to practice this answer. So when you think about it, being a lawyer is about helping people at potentially the worst moments in their life or planning for the worst moments of their life. You could be defending someone in a criminal trial and they could be facing jail time. You could be talking about bankruptcy law and people losing everything, or family law where suddenly their marriage is broken down. They're having fights over custody of their children. Even things as simple as planning for their future with wills, estates, power of attorneys. You are helping people navigate a system that they don't understand at the worst possible moment in their lives, or what could be in the worst possible moment. Nursing's very similar. So especially where I work now in ICU, but even when I was in aged care, you are either ushering them to the end of their life in aged care, helping give them that quality of life in a system they do not understand, helping the families in a system they do not understand, or in ICU, they've had a cardiac arrest. They've been in a major accident and where they're taking care of them and their families in a system they do not understand. So it's all about being able to advocate for them. In law school, we're taught conflict resolution. We're taught advocacy and fighting for what your client needs. We're taught things about confidentiality and privacy, how to maintain that, how to emphasize that at all times, how to make sure that the person you're looking after or representing is getting the best quality care or the best quality outcomes. And it's pretty much the same thing. It's just in a different jacket. I used to wear a suit and now I wear pajamas to work. But the skills are very, very similar. At the end of the day, my passion comes from helping people where they need help, whether that's, sitting in a table and in an conference room somewhere or standing up in court to now performing CPR. I'm helping someone.
Yeah. And, you know, I see now what you're describing, that there is a lot of overlap between law and nursing. I think that's, especially as you're in aged care, or that there must be a lot of conversations around that as well. You also listed a few responsibilities of nursing. Like, everybody knows, I feel like, what a nurse is, but can you tell us a little bit more about, you know, the exact responsibilities of a nurse? Because I feel like nurses, to me, I think they're superheroes, you know, like you have to do so much. But what are your main responsibilities as a nurse?
So I think this is a fun one because a lot of people don't really think about what a nurse does. They go, oh, on the TV show, I watch the doctors come and do everything, and then the nurses are just there playing solitaire in the nurses' station, and they might help take them to the toilet and give them a shower. That's not reality at all. So, like, for us nurses, and it's the same whether you're in ICU or on the ward, we're constantly there for the patient. We are the primary caregiver in hospital. We're the primary caregiver in aged care. The nurses are the ones performing the treatment. So a doctor walks in and spends 5 minutes with you. The nurse is there for their whole shift, for 8 hours, 12 hours, however long their shift may be. They are the ones constantly assessing the patient, noticing the changes. They're assessing whether or not the interventions we've done, whether they're, you know, a surgery that's happened the day before, has that had the right effect? Are you now feeling better? Do you still have pain? You know, are your vital signs improving? Are you still bleeding out? We're the ones there on the front line with the patient, constantly assessing what is happening and providing that treatment. So a doctor goes, you need this medication to get better. Then they nick off. It's the nurse who actually gives you that medication. It's the nurse who checks to make sure it's safe to give you that medication. It's the nurse who goes, hey, doctor, actually, they can't have that. They're allergic. Or did you mean to add an extra 3 zeros to this dosage? I don't think we should be giving this. The amount of times I've saved people just from simple doctor's mistakes. That's what the nurse is there for. And yes, of course, there's things like toileting people. There's giving them showers and bed baths, and there's doing dressings on their wounds. There's helping them to eat if they can't feed themselves anymore. But we are essentially the everything job in hospitals. You know, your physio may come and say, you need to do these exercises. They'll do them with you once and say, repeat these 10 times today, and then they go away. And it's the nurse who has to come and remind you. So the nurse has to help you do those exercises, get you in and out of bed, and get you walking down the hallways to improve your recovery. You know, you have the social work aspect. We're the ones helping you navigate the system. We're the ones helping you navigate your family dynamics. And there's plenty of those.
Yeah.
As you can imagine, especially in ICU. The visitors are always interesting. And providing education. So a doctor will say, you need this medication because you have heart failure. Cool. They go away and the nurse has to explain, A, what heart failure is, because the doctors do half-assed jobs of explaining it. And then this is what this means for you going forward. You know, you now have to drink X. You have to take this medication. You need to look after your heart in these ways. And then navigating the fear and the uncertainty that patient goes through as they learn this new diagnosis. And what's that going to mean for the impact on their life? That's on the nurses. We don't have enough time to do this. We don't have enough resources to do this, but we do it anyway.
I actually really enjoy that explanation, to be honest. And I've always thought, I know what a doctor is, I know what a nurse is, and luckily I haven't spent a lot of time in hospital. And I think for me, that's a good thing. But I think your explanation has been really good. Like, the specialist, which is a doctor, comes in for a very short period of time, but ultimately the care, the distribution, the treatment, all of that is the nurse's responsibility. And that's why there is such a big percentage of nurses, because there's so much that you'd have to do rather than just diagnose, but there's all the caring that has to happen. So yeah, no, I actually think that's a really great explanation, because that's given me a lot more clearer in terms of the differentiation between the two professions.
Yeah, my favourite joke about that is I often tell it to patients as well when they're a bit nervous, or families, and especially our grad nurses. I kind of teach them about their responsibility with a bit of a joke that I came up with years ago. It's how do you tell the difference between a doctor and a nurse in aged care? Oh, sorry, not in aged care, in hospitals. The nurse comes alone.
Oh.
The doctors come in packs.
Oh.
Every time a doctor shows up, they have all their cronies with them because they're coming in to do their rounds. They all talk about you, to you, and then walk away. The nurse comes in alone every time. And they go, oh. There's a bit of realization. They find it funny, and then they go, oh. This is true.
Yeah.
We do everything just one person, and doctors just come in this big hive mind to chat to each other and then walk away.
Yeah, interesting. You've also worked, as you were saying, that you've been in the residential aged care facilities and you've also been intensive nurse in hospitals as well. These seem to me as two very different environments. Is that very usual in terms of, is it easy to switch between the different settings? Is it hard also to need to switch constantly between the different settings too?
I think for me, I'd had a few years to settle in aged care first. So I've got a really solid background there before I even step foot in the hospitals. But for the most part, a lot of the people in hospital, they're not your 20, 30-year-olds who are fit and healthy. They might come in via ED, get seen in ED briefly, have a 1 or 2 day stay in the hospital somewhere after acute surgery or an acute episode, and then they go home. I mean, you have your fair share of chronic patients or, serious issues for the younger cohorts, but for the most part, our patients are elderly. So they're facing very similar issues in hospital as they're facing in residential care. Maybe to a lesser extreme in like the cognitive dementia stuff, but if you work on a gen med ward anywhere in the country, you'd know most of your patients have dementia or have a cognitive impairment or have some kind of severe mobility issue. There's hundreds of patients who are awaiting care beds. They're awaiting permanent residential beds in hospital. So you're essentially providing aged care treatment in hospital. There is a very similar cohort in patient type, and the issues you're facing are very similar. And that helps. So we like to say you can spot an aged care nurse in ICU. You can tell who spent time in aged care because we are better at dealing with the challenging behaviours. So your dementia patients or your psych patients who are having a moment, we'll put it that way. They're cooler, calmer, more collected. They have already had that kind of de-escalation training honed into them. They do it every day in aged care. So you come into the hospital and you just see it. And your personal care skills are, second to none if you've worked in aged care, because all day, every day is, helping to shower and bathe people and feed them and make sure they're eating and drinking and functioning and looking after themselves, because it's all about encouraging independence. That starts for the minute you walk in the hospital as well. If you're in ED, we try to encourage independence. We try to encourage rehabilitation. It's always about the end goal. So if you've done all that in aged care, it's really easy to bring that across to the acute care setting. So we like that.
Yeah, no, there's so many links, and I do understand that now, that because you've got that aged care training, that emotionally, I think you're more aware of all of that once you bring that into the hospital setting as well. It's quite funny. I was reflecting on how you were talking about doctors in packs, and Scrubs is one of my favorite shows on TV, and they're always doctors traveling in packs, But we all know it's the nurses that are kind of like the backbone to that hospital, right? So I just found that really funny when I was reflecting on your comment just now. So
it's funny because Scrubs is actually considered one of the more accurate healthcare shows.
Oh, really?
It's still completely not accurate, but it's one of the more accurate ones because it actually emphasizes the role the nurses do and the relationship between the nurses and the doctors. Think of Turk and Carla. No one
She's the
does
boss,
run by
100%.
Carla. She is the boss, and that's the reality in hospitals. The nurses are bosses. Oh, yeah. I have the consultants in the ICU doing what I say some days. Actually, frequently. We tell them what to do a lot of the time, and there's the old joke going around in America at the start of their intern year, just waiting for one intern to tell a nurse what to do. Like, you tell that senior nurse something, and they're just like, we're going to eat our young. The doctors know the nurses are in charge and just wait for that one who thinks they're not. It's quite fun.
Well, I do think you need to respect the nurses, right? And as I think it's a very important profession. You mentioned a few things like, it's not an easy profession either, that there must be a lot of invisible parts of nursing. You spoke about some of the emotional things, the mental things, the coordination. What are some other things that the public don't openly see? I mean, we see one side, which is the nurses helping you with your toilet and your food and your medication. But there must be what goes behind when you're sitting in the room by yourselves, or give us the backstory.
A lot of the time it's dark humor. You manage with dark humor. So most nurses you'll meet are pretty I wouldn't say jaded. That's probably the wrong word, but slightly so. And it's just how we learn to cope, because we are always short-staffed. We are dealing with a system that doesn't have enough money, doesn't have enough staff doesn't have enough time. We've got the pressures of getting people out of the hospital, but there's nowhere for them to go. Like I said, a couple of hundred people just in South Australia waiting for aged care beds, and there's no beds for them. So your system is constantly under strain, and even worse so since COVID. And of course, that puts a physical and fatiguing toll on the nurses. We've also got a new, essentially, problem in nursing in Australia. Since COVID, we've got a mass exodus of our senior staff and our mid-career staff. So you used to get, your retirees, they'd hit the end of their 30 years of nursing and they'd start to retire and fade out. But you'd have a new crop coming in and hitting their 25 years plus, and there'd always be this slow churn. COVID hit and we lost significant numbers of nurses, really. And then post-COVID, you had a lot of people in that mid-career range go, you know what? I don't want to do this until I retire, so I'm going to walk away. Or I could do better. Or the hospital system has finally broken me. And they quit and they move on and they do nursing somewhere else in, community, or telehealth nursing has taken off. So that mid-career group that used to replace the aging, retiring group is being barren. There's so few left, which means you've got a hospital run by 20-year-olds because they're the most senior on the floor, teaching the new nurses, the graduates. You've got the young teaching the young rather than the old experienced ones around.
Are you seeing that
So
in
fatigue.
most hospitals, or is it just in like the hospitals you know about, or
Everywhere.
really?
Everywhere. Obviously, some places, some sectors, some units, some types of hospital feel it more than others. But the biggest part is the fatigue that has on those few of us who are in that, mid-career level or entering that mid-career level. You've got a higher cohort of juniors than ever before. Because how do you fix no staff? You hire more staff. But the new staff come with no experience or very little experience, or they're changing from one job to another within nursing, so that experience doesn't really apply. And instead of being able to focus on consolidating your own skills or hitting that management level, you are constantly running around taking care of new nurses, because you have to, because otherwise we won't have any nurses in the future. And no one's there to kind of help you out, because your seniors have all gone. It'll be good in about 10 years' time. We'll have a huge cohort of mid-career nurses, but for now the sector is struggling. And we look towards the projections in the next 10 years of being, 80,000 nurses short in Australia. And that number just keeps going up depending on who you talk to and what sector you're looking at, which is kind of scary. So that's been fun. It's always fatigue. There's fatigue everywhere. Never mind the emotional side of it all. And
That's interesting. You know how everyone's blaming AI for like taking your office jobs. If there's such a huge gap in nursing, maybe we need to consider nursing as a career instead.
pretty much.
That's
Nursing has got a lot that you can do in it. It's not just your traditional nursing anymore. There's so many avenues you can take, and I think people need to embrace that more and more, because those non-traditional avenues are where we're going to find solutions to the problems we currently have. It's just a matter of time.
There's definitely a global shortage of nurses. Like, I was reading stats from the World Health Organization, and they're saying that there's a massive shortage globally, not just in Australia, of nurses. And especially as population is aging, chronic diseases is increasing, we're going to need more nurses. So, yeah, and hence why I was very keen to do this episode, because I wanted to talk about some of the positive things about nursing as well, because there's a lot.
Oh, shucks. I promise it's good.
But you're still in it. Went from a lawyer to a nurse. What's your favourite thing about being a nurse?
What's my favourite thing about being a nurse? Just how many doors it's opened, how many places I can go with it. You tell someone you're a nurse and they go, oh, wow. And they instantly kind of trust you. We're the most trusted profession actually in the world is nursing, funnily enough. Yep. So with our company, as soon as I start talking, people listen more. My brother will try to sell, to someone at a convention and be talking about the product, and we can do X, Y, Z, and this is so fantastic. And they're going, yeah, that's great. And then I come in with a story from the front lines and it clicks. So it's just about having that relatability, that's the word, to anyone, anywhere, because I've seen that many patients now that guaranteed I have a story that will match your family. That's what I like about them most. I can talk to anyone, and I can go so many places. Like, I've It's like I said, we've started a company. I've just done the CSIRO program. I've been off to conferences around the country the last 12 months. I've had 5 different jobs in the last couple of years within, I work in tech, I work in clinical, I work in aged care, and it's all from being a nurse.
Yeah, amazing. I love that. That's so good. Yeah, it goes to show that there's so many different avenues and paths in nursing as well, which is fantastic. So there's also like, I don't want to be too down on this, but there's also some bias and some stereotypes as well.
Yeah.
And because nursing is a very female-oriented profession. Like I was reading the World Economic Forum, it says that 90% of globally of nurses are women. And which is a lot, to be honest, there are some male nurses, but they're only 10%. So I'd love to hear a little bit more your perspective in terms of, is there gender bias in nursing and what does that look like?
Oh, yeah, definitely is. People, just look at your typical nurse costume and how lovely that looks. The little short skirt and the little, yeah. That's what people think about nurses. Thankfully, that old guard is kind of fading away. That stereotype is going, but it's still there. You get patients who still say similar things to you and naughty things because you're a nurse and nurses are sexy and you're not here to treat me. You're just here to clean me and take care of me and roll me. And it's a bit creepy and weird because they don't do that to the male nurses. But the male nurses, oh no, they're homosexual. They must be. Why would you want to do a female's job? Why would you want to do this job? It's very strange, the attitude we get from public. And it's definitely generational. So we see a lot more of that in your older cohort than you would see that in amongst your, your millennials and younger. So hopefully that means the stereotypes are fading out and this approach that, oh, nurses, yeah, is fading too, would be good to see. But I think the paradoxically, the thing that's weirdest is the responses the males get in the profession. So, nurses are all females and, oh, you're just a nurse and you're a girl over there, do your thing, whatever. We don't really care as long as you take care of me. The male nurses, though, they get a whole different rap. It's always the question of why are you doing this? Or shouldn't you be a doctor? Or are you the doctor? You don't get a female nurse getting asked, are you the doctor? You get a male nurse getting asked, are you the doctor? And that's like their little, chuffy moment for them. But that's few and far between what they actually get. I think a lot of the time the guys go into nursing because, there's some kind of calling, some kind of reason they want to be a nurse. And then they walk into the hospital and all they get is, oh, why are you a nurse? But they have to explain themselves. It's weird. It's the nurse, the idea of the nurse.
Have you seen the movie Meet the Parents? And Ben Stiller was a nurse. And...
Yes. It's very much like that. It's that why. Why are you a nurse that they get? Like it's weird or bad to be a nurse if you're a guy. But for the females, it's, oh, that's expected and, oh, you're sexy.
So strange, isn't it?
How is it so different?
I don't know.
Just based on your gender. And I think people think that.
Do you think it's from like movies and like, where did that all come from? Like, is it TV? Is it the shows or?
It's a lot of it's generational, sadly. Nursing was the support work in the hospital. It was, you were paid a pittance to come in and clean up after the patients and the doctors. This was back in a time where the doctors did a lot more. And the nurses were just there to help and clean because they could do that whilst their kids were wherever or when they were single, It was something to do. It wasn't a job. It wasn't a profession. You were hospital trained to fold sheets and do the laundry. It was a very different profession going back 100 years.
It's definitely professionalized, hasn't it? It went from maybe kind of like a caring support role into an actual, a very big profession now. And obviously, the biggest profession in healthcare. So,
but that's where the stereotypes come from. And that's where the generational issues sit. So as that generation who knew nurses as that very simple, task-driven, hospital-trained job fade away and sadly pass away, hopefully some of those stereotypes will go with it.
I mean, how many degrees do you have in nursing?
Me?
Yeah.
I've got 2 nursing degrees.
There you go. So it's a profession.
A few more to come. Yes. Yeah.
You know what I mean? Like times are changing. Yeah, it's very different. I'd love to talk about aged care and elder care because the WHO says that globally, populations are aging very, very fast. by 2030, there's about 1.4 billion people with a B that's going to be age 60 years plus, and roughly 1 in 6 people worldwide will be over 65. So that's a lot of aging people. And I'd love to hear from, your experience. When do families start thinking about moving their aging parents, grandparents, family members, relatives into, long-term care, such as the residential aged care homes? And what triggers that decision as well? Like, when do we start thinking about aging as a family conversation?
Funnily enough, in recent years, and I'm saying recent, like maybe the last 10, 20 years, we've thought about older or elderly as much later age than it ever used to be.
Is it because people are living longer?
Yeah, a lot of people are living longer and people are staying home longer. So the supports exist now to keep them at home for a lot longer, to keep them engaged longer. I mean, you can't retire until you're, 67 now. Like the pension age is so much older than it used to be. So we are extending artificially how old elderly is, which is why it's always interesting to see that things like the World Health Organization saying that it's over 60 or over 65 is elderly. Because you talk to anyone who's 65, and I guarantee you 2 out of 3 will say, "I'm not old. My mum's old." Like, and their mum's 90 and she's still at home. So people aren't thinking that they're old until they're much older anymore. It's a conversation that's happening later and later, which is great because it means people are living longer and living healthier longer. But it does mean that when that conversation happens, they are generally worse off. So if it's a cognitive issue, they have declined much further than they would have declined 10, 20 years ago because they've managed to stay at home for that extra few years, which is great because they've been in their own space. But have they really been looking after themselves well? And when they go to move into aged care, suddenly it's like that safety net's been pulled out from underneath them. So you say that someone with a cognitive impairment at home can, what we call, mask. They can pretend, they can fake it till they make it to hide their level of cognitive decline. You put them in a nursing home and suddenly they don't have any of those coping skills. They don't have any of those little strategies. They can't hide how bad they are. And the transition's a lot harder. They decline a lot faster. But reality, they're just actually showing you how far they've already declined. And it makes jumping into aged care more difficult for them. That's cognitive issues. Generally, it's something that's happened to that person. So they know that they're cognitively no longer able to stay home and they ask. That's the rare case. They go, "Oh, I don't think I'm doing very well. Maybe we should look into it," or something. And they're saying that to you. In reality, they haven't showered for 3 weeks because they've forgotten how. But they've got the wherewithal to say something. That's few and far between. Most of the time there's been an incident at home for the cognitive decline. They've left the toaster on and burnt down something in the kitchen. They've had a fall and didn't know that they weren't wearing their fall bracelets, didn't know how to call for help, and they've been on the floor for 3 days. They've locked themselves out of the house overnight and haven't wanted to be a bother to ring anyone because they didn't want to tell anyone that something had gone wrong. There's a lot of issues, like big moments that drive them to move into care.
Yeah.
And for the other...
is it because then cognitive is much harder to detect than, say, physical? Like physical, you can't do it, therefore you're more likely to go get helps like faster. Whereas the cognitive one, you can actually hide that a lot better. So therefore people may not know, your family members may not know for longer.
It's exactly the case. And it's strange because you'd think you'd notice it, but you don't. And like my grandma, she moved into care. She's been passed away for about a year now. So we'll say 2.5 years ago, she moved into care. She was in care for just under a year. She really thought she was doing well at home for the most part. The minute she moved into care, my aunties and uncles and my mum were going, "Wow, she's actually like really struggling. We didn't realize." I said, "I did," but no one wanted to hear. And I didn't really want to scare them by saying, "Actually, I think she's struggling," because they would go over and have coffee with her and she seemed to be doing okay. But you put her in the nursing home and suddenly she was calling us at 2 a.m. because she was scared. Because all of the things that reminded her where she was at 2 a.m. at home, now she's in a scary, completely different room. She hasn't got those grounding objects or the reassurance,
like the familiarity.
That familiarity, that helps them. So if you move someone with cognitive impairment into aged care sooner,
Yeah.
I'm not saying before they have any, like in those earlier stages, if you're actually able to catch it earlier, and sometimes we're good at that, but if you catch it early enough, they can move in before the cognitive has faded off too far and the aged care home becomes a familiar scenario. So as they lose more cognition, they become more comfortable, they have less behaviours in aged care. Overall, it's a much more pleasant experience for them. But for families who are dealing with a physical reason, it's generally something pretty major has happened pretty clearly. You know, they've had a major fall and break in their hip and they can't walk now. Even post-surgery, they just couldn't do it, so they can't be at home. Or, you know, they need a full assist now. They can't walk, they can't do it in a wheelchair. They have had a major stroke. They had a heart attack and had been in hospital for 12 months with care post that and could never really return home now. Or you get a few older ladies, especially who like to move into care in the earlier stages of the physical decline because they know they can't do their washing and cooking and cleaning anymore. And it's that realization of, I can't, you know, and that's a lot easier to have that conversation. That's a lot easier of a trigger is the physical moment.
And so now I know that there's a lot of different varieties of care. So you've got people staying at home and you've got assisted living, and then you also have the aged care facilities as well. Can you tell us a little bit more about each of these and kind of like what ages or what abilities for these three different stages?
I think the really cool thing with our system here in Australia is that you can be of any stage, really, in any of the three kind of mainstream options. So, you know, you're thinking at home and support, that's your home care packages, or help at home now, I think it's called. I don't know, they keep changing what it's called.
Support at home, I think it is, yeah.
Support at home, yeah. They change it so they can change how they charge you. So, you know, it's like they're doing something. The government goes, yeah, we've changed something. Look at us. We've slapped a new fancy label on it, but it's the same thing. Pretty much what it looks like. But it's, you know, your home care packages, you've got carers coming into the house to help shower you a couple of times a week, or you've got someone who come and take you out to the shops to help you do your groceries. You'll have a gardener, or, you know, your nurse come and do your dressings and your medications at home with you. It's very much an independent, you are still taking care of yourself with a bit of support. All the way up to we can have carers coming in and utilising full lifters in someone's home. So you could have an elderly person who's determined to stay at home and on the top level funding package, and they can do enough for themselves once they're in a wheelchair, say, but they actually need a full lifter to get out of bed.
Oh,
so they'll have a team of carers come in the morning and a team of carers come at night to lift them into the chair and then out of the chair.
Wow, really?
I've seen that happen.
And they still want to stay at home. Wow. Okay.
So the system exists to keep people at home as long as they want to. The downside to that is if you're staying at home in one of those situations where you're essentially not full care, because if you were full care, that's round-the-clock carers, which is technically can happen but doesn't happen. The care you're getting isn't that great, because we physically do not have the number of carers in the home care scenario to give you good quality care when you need it. So if you get lifted out in the morning and you have a carer come and do your toileting in the daytime or come and help you with food prep at some point, they then have to go and take care of all those other people on their register for the rest of the day and come back and put you back to bed at night. What happens if something happens and they're not there? They're not there. You can't help yourself anymore. At least you're in your own home, but you can't help yourself for the things you can't do. So there's a bit of a balancing act of what we can offer to potentially what we should be offering at home. Then you move up to things like your assisted living, and they're like, you know, I've moved into a residential village rather than a nursing home. You know, this is my own unit. There's a whole bunch of other units around me, and I can do my own thing, but there's a nurse on site. There's carers on site, and they'll come in and out a few times in a day. The nurse will come and do your meds, and if something happens, I can press a button and people do appear. Those models are growing in popularity. They're a very strange model still because they're so different depending on provider. But again, it's all about what they call aging in place. So that means don't come to nursing homes, stay at home, stay where you are, stay independent, and we'll help you to do that.
Yeah. My parents' friend just bought into an apartment block that has something like that, where there's like a doctor and nurse on site in the block, and Yeah, so people can buy into, like, I think it's in a whole apartment block, really. And they've got nurse, like they've got medical care, which I think it, like, it's a good thing if you need it and you need someone close by.
It's a good solution to the support at home model where, hey, you need to be lifted out of bed in the morning and night time, but other than that, we're going to leave you be because we can't be there the whole day. Well, if you're in an assisted living scenario where you need that help, but you can plod along and do what you can still, but you don't need aged care because you can still do something, you could have those carers, those nurses around when you need them to do those, you know, instances of full lifter out into the chair or toilet at lunchtime or help you with your meals if you need it, and then otherwise be independent. But if something did happen, they are still there. You have that backup that you can't have in your own home with a supported home. You have a permanently available backup in assisted living. And some really cool ones that are popping up around the place are kind of like what you said, an apartment structure where at the very top you've got your fully independent supported home people kind of thing. And as you get to the lower floors, you've got more severe care. So you might move into the building, buy into the assisted living scenario on a top floor earlier in your aging process and go, yep, this is where I want to live. And I know that when I need higher needs, I'll move to the lower levels where you've got permanent carers on the floor and it's more like an aged care home, but you're still within your building. You haven't had to move. But it's that recognition that something's changed and we can now give you a different level of care, which is really cool. I love that new model. It's coming out more and more, which is great to see.
Yeah.
It's got the best of both worlds.
Yeah. And how about the aged care facility? What's that like in a typical home?
A typical home, like
Aged care facility, nursing home, retirement home.
Nursing home. I love it. There's so many different terminologies for it now because I don't like the word nursing homes. Residential care facility. It's very different to what people think it is. So you talk to people about aged care and they're all scared of it. It's very taboo. I don't want to do that. I don't want to live in aged care. Oh, you can never put me in one of those. I'll never go in a home. And I think the key word there is it's a home. We try to make them as homely as we can. So some of the older buildings, still look a bit dingy in places.
Yeah.
But they are trying to modernize them and upskill them and improve them all across the board. You go into a modern aged care home now and the rooms are quite large. They have private en suites with all the amenities you could possibly need. You've got multiple lounge rooms. You've got cafes. I've been to one that had a beautiful cafe in the middle of the downstairs area for looking out over like 3 different courtyards.
Wow.
And lots of different spaces. I've been to one that has a playground in it for when the grandkids come to visit. It's great. They have concert halls. I used to work in one that did happy hour on a Friday for the residents. So they had this, like, they called it the beer garden. And it was like you would imagine.
That's really fun. Wow. There's a lot of life and personality.
It was good. It had a glass roof and the windows and they had a pool table.
Wow.
And the residents would flock there on a Friday afternoon and we'd give them booze within what they're allowed.
Yeah.
But it's the same as living at home. If you wanted to have a drink, you can have a drink. We have to thicken it. If you've ever tried thickened beer, it's definitely an acquired taste. But they would come and they would have a drink. It's not the scary white wall bed frame in the corner, laying there all day staring at the ceiling. It's get up, get showered, function as you would normally. You've got big TVs in the rooms now. You've got bingo activity afternoons. I used to drive the lifestyle bus for a facility I worked at. So I used to take our residents shopping twice a week and to cafes for lunch. I used to drive a 10-seater bus. It was great. And we'd take people out in full wheelchairs. So they were full lifters who needed like full assist for feeding, full assist for changing. But we'd put them in a wheelchair, lift them into the back of the accessible bus, and I'd take them to the shops.
That's fun. Yeah.
And that was good fun. We still love doing that. You play games with them outside. There's a much bigger focus on lifestyle now than there was, 30, 40 years ago.
Which is like a huge change, isn't it? So in terms
massive.
of before thinking of what aged care facility is to, I think now when they're trying to make it more homely, make it more sociable, make it more community as well, which I think is really great. So I do want to ask you about social isolation because, yes, we're talking about these aged care homes and facilities, but, there is a lot of issues in terms of social isolation. Can you tell us a little bit more about that and maybe even some of the challenges you've seen as well?
Absolutely. So social isolation is probably one of the biggest things that people don't really realize occurs in the elderly population, whether they're at home or in care. Your world gets smaller and smaller the older you get. And that's not just because, friends and family may be passing away and your network gets smaller that way, but it's a simple thing as you can't leave the house without help. You can't operate technology without help. So you can't ring for someone to come and chat to. You can't jump on social media the way we do to interact with the outside world. Social isolation is essentially so you think about loneliness, being alone, being lonely. I haven't got something to do. I haven't seen anyone for a while, and I feel like I'm unloved. I feel like I can't do anything, and I just feel kind of alone. Social isolation is the next step. It's where not only do you feel alone or lonely, but it actually starts having clinical effects. So if you're socially isolated, you don't have the desire to do things that you may otherwise do. You know that no one's coming to see you. You know that if you try, you can't actually make that connection happen. You become locked out of the rest of the world. And it can be a simple thing as not being able to operate your smartphone anymore. There's too many passwords on my phone now. I mean, I can't even work out two-factor authentication half the time, let alone my grandparents trying to do that. So you suddenly are cut off from the outside world. And that's what social isolation really, I could give you a textbook definition, but that's essentially what it is. It's I can't access the world and the world can't access me. And paradoxically, this can even happen within a residential home. So you could be surrounded by people all the time, but you've still got social isolation because the people you're around are other elderly people you don't know. They're other residents. You don't interact with them rather than being essentially forced to come out to the dining room to eat lunch with them. And that might be the only social interaction you get in a day besides your carers coming into your room to provide you with care. But your family, they can't come visit you whenever they want. You may move further away. They have work commitments. They have children commitments. There's life that they have to live, that you have to live. Or an isolation happens. So, COVID lockdowns were great for that. Suddenly you could not interact with anyone. And it has clinical outcomes on people. They get more behavioral. We say behavioral meaning like the cognition gets worse. So they scream, shout, kick, hit, punch. They take a disinterest in their own life.
Wow.
They don't want to look after themselves. And if they don't want to look after themselves, the health gets worse.
And high rates of depression maybe as well.
High rates of depression.
Yeah, early mortality.
It's actually really depressing to see the level of social isolation. So they say that 1 in 5 older Australians have experienced loneliness or social isolation. And in aged care, that's 1 in 3.
Wow. Okay.
So it's actually pretty well entrenched. You walk into a nursing home and most people are feeling some degree of social isolation or loneliness.
I want to talk about your experience. I know your dad was living in a residential aged care home, and he was a big part of your story, which is, what you're developing with your brother, Care Window, where you are a co-founder. Can you share what was happening with the family at the time?
Yeah, I can. So, Dad's story is essentially the base of Care Window, but Dad's story is one of hundreds that we kind of experienced that led to Care Window. So I was working in aged care, and Zach was a computer developer, software developer with his own company. So we've got a bit of the skill set behind us. But Dad had been sick my whole life. He got cancer when I was, like 7 or 8. Got over that. Had something so he had radiotherapy to the spine and brain in the mid-90s, back when it was first a thing. And he developed something called SMART syndrome, which is stroke-like migraines after radiotherapy. It didn't even have a name the first time he had an attack. And he had that in 2007, his first one. By the time he moved into residential aged care, I think he had 5 or 6 of these attacks. They're like strokes. They behave like strokes. He had to learn to walk, talk, eat, everything again each time. So 2019 happened. He had one of these episodes. He'd been in hospital for months. Gone into rehab, had almost died in rehab, got resussed, long story there, and became a full lifter, full assist. His cognition with each of these attacks had gone down a little bit, but this was a really big drop for him. And we all talked it over. He knew as well with us, like a long time before, we'd had these conversations. If I become this bad, I can't be at home. Like, I can't put that on everyone. I'd have to go into care. So he went from being independent at home, needing a little bit of help from mum and me and my brother, but being independent, to being a full assist wheelchair user, sling lifters, the whole typical aged care resident persona. And he was 65, just after his 65th birthday. So we moved him into aged care. Yeah, it was very, very young. You can only move into aged care at 65, pretty much, unless there's like extraordinary circumstances. The general starting point is 65. He hit 65 and was in aged care, one of the youngest residents in his building. But December 2019, we realised he needed to go into care, so we moved him into care. Thankfully, with my experience working in care, I was able to pick a really good facility for him, and things were going well right up until COVID hit a few months later. And when COVID hit, all the aged care facilities went into full lockdown. So you now couldn't visit. You couldn't go in to see them. You had to have what we call window visits, where you'd go to the window and you'd have your phone, and a carer would bring your loved one to the window and have a phone against their ear, and you would talk on the phones while seeing each other through a window.
Wow, that's crazy.
And you'd get that once a week.
Wow.
If that. Because it required such an effort on the staff to facilitate this. And of course, social distancing. You can only really have one person at this window at a time. You had to schedule it in for the 100 residents in your nursing home. Then obviously, once we kind of lifted some of the restrictions and you could visit, you could have 1 or 2 people visit you for an hour a day in a 24-hour period. Otherwise, you were fully reliant on a carer going into the nursing home room with a phone to help you make the phone call. Dad went from being able to operate his TV and teaching me and my brother what we know about computers, because he was an IT guy in his prior life, to not being able to function to turn his TV on. He couldn't turn the TV on, turn the DVD player on and watch a movie anymore without help. You called him and he would somehow hang it up, and that's if he could physically get to his phone, because if it was placed slightly out of reach, he had no way to pick it up. He couldn't move himself to get it unless he was in his wheelchair and it was, within wheelchair reachable space. And that's if it was on charge. If it wasn't dropped behind the bed. If it was on, because he didn't know how to turn it on anymore if it was off. And I saw this hundreds of times over in all the residents, in all the facilities I was working at. So I think for us, it was a matter of that close to home. Like, you see it all the time, but now it's your own family member. And you go, there has to be a better way.
I'm sorry to hear that. I think that is must have been really tough for the entire family, and especially during that time. And now knowing that you've called your product Care Window, I think is, for the ones that don't know what it is, maybe you can explain what it is. But it is kind of like, that scenario that you described, the window, and you're holding it and you're speaking to another. Do you want to describe what your idea is and what your product is? Yeah. Because I think that now that name has such significance, I feel.
Yeah, so Care Window is a simple video phone designed specifically for people with cognitive or physical disability to remain connected. We used to call it our telepresence device, because you could be present again with each other through a video phone. It's a small phone. I actually should have brought one down with me. I should have one upstairs. I should have grabbed it. That would have been great. But essentially, it's a small screen. It's mounted on, think like a Google Nest kind of style setup. It's like a tablet. Sits upright, and at a touch of a button, you can ring anyone from your device that you have got connected already on that device. It's not like a normal phone. You can't get spam calls coming through. It's locked down to just who you're connected to. And instead of requiring 4 to 6 steps to make a phone call or receive a phone call, Care Window takes away all that complexity. So we designed and co-designed with aged care residents, aged care staff, families, and some collaboration with Flinders University to remove all of that complexity, to make it dementia friendly. It's 0 to 1 touch at all times. So instead of complicated menus and passwords, it's a tap of a button and instantaneous video connection to your loved one. Some of the early stories from our early pilots kind of explain it better than I ever could. We had one family member able to talk to their loved one in aged care from across the globe and see each other face to face for the first time in years, because they installed Care Window on their phone and we gave a demo unit to this facility. They put one in this resident's room, pressed the button, and instantly connected. And the carer didn't have to stay in there holding a phone. The carer could nick off and continue to do, the rest of their daily jobs, while this resident who's bedbound and who cannot operate technology themselves because they know they've got dexterity issues, they could talk to their sister in the UK face to face, see each other. It was brilliant. The same resident actually couldn't come into the concert halls at her facility. So the carer took their phone, went into the concert hall during a concert, turned on the Care Window app, made the phone call back to the resident's room. Because it was set to auto answer, she didn't have to touch a thing, and the concert popped up in her room and she was able to watch and participate in the concert in the hall for the first time since she'd lived in that facility.
Love that.
It's great. I could go out and go to my son's soccer game and ring my grandma and she could watch my son playing soccer. One of our early use cases was, you could be sitting around at home having dinner, ring your loved one in the nursing home, and it's like they're having family dinner with you because you could see and hear them face to face at all times.
I think that's really important. It kind of overcomes that social isolation, that loneliness that you were talking about. And I think it's really important that families can really communicate to their loved ones inside a facility like a aged care home, which, as you say, as you get older, it's harder for them to operate all this technology, right? So you need something that's really easy and still be able to operate it, and, not having a nurse there to kind of help facilitate that. And I keep thinking back that story, as you were saying in COVID, how you had to go up to your window. I'm like, oh my gosh, like that I think is really, really amazing how you can now do that without, far easier, I think.
Part of it came about being the idea of we'll bring the window to their room. No longer do you have to be scheduled to come out to the front and talk through the front. The window is a window into their residential room, into window into your home at home. It's an easy way to actually see and be part of each other's lives, because we know that sometimes attending in person is difficult.
Yeah.
Or in terms of COVID, impossible.
Yeah. I love that. I love that name now. Like, it gives such a big meaning since you've told me that. And yeah, no, congratulations. And also, I saw you pitch as part of the CSRO on Innovation program. You did so well on the stage pitching Care Window to, can I just say, a huge audience.
And it was
packed house.
Too many.
Were you very scared when you were doing that? And then, yeah, I'd love to hear your experience on Innovation program as well as a founder.
Oh yeah, I was having kittens the whole day leading up to it. In fact, there was a running joke that I threatened to quit every 30 minutes for the 3 days prior and about the 3 weeks prior to that as well, from the moment they said it would be me pitching. Thankfully, I didn't quit. The team at On were fantastic in getting me through, teaching me everything I needed to know to go up on stage and do it and nail it. And to be honest, I'm so glad I did do it. And I'm so glad I had them in my corner, encouraging me along. So it was definitely an experience that I'll hopefully not have to do again for a while. No, I'm kidding. I'm kidding. I definitely have more
so well. I think,
No, that's
a lot we can do it many times.
They give us a lot of support. A lot of coaching, a lot of training around the pitching. So no, look, it was fun. It was definitely nervous, but it was fun. But the whole program was a bit like that, just teaching us things that it's like doing a master of business in 12 weeks. It was, for me, taking me out of the clinical and into the business side of the business. I was definitely upskilled a lot, taught the lingo, taught what to look for. And as a company, we were probably a bit more advanced than a lot of the others, being that we're already in market and we've already made 3,000 plus sales. At the time we started, we hadn't hit that number yet. By the time we pitched, we were at 3,000, I think.
Wow.
But yeah, we were a bit more advanced. So for us, it was really about getting us ready to scale up, taking us from a small, essentially retail company with strong, research background and links and ties into things like ARIA, which is the Aged Care Implementation and Innovation Group out of Flinders University. They're fantastic. They joined us for the journey with CSIRO's program. But it was about getting us ready to scale up. It was about how do we take this small company and actually make the sales, make the impact we want to make? How do we take it from, here to here? And the facilitation and coaching we got was just incredible, and I couldn't be more thankful for it. So throughout the program, we kind of had a few aha moments that have changed where the direction we've gone in. We've now developed a bit of a growth plan for the next couple of years. So watch this space. There's some changes coming, some big deals hopefully coming soon. We've just closed a fundraise, so that was exciting as well. Hit our target.
Yay!
Always nice when we talk about money and getting money.
Yeah. Oh, getting money, getting funded,
Getting
always
money
a
is
great
great.
conversation.
But they kind of made us think a bit harder about some things. So like who our customer really is and what other kind of customers can we still hit. And I think we went into it with an idea of what we were and what we wanted to do next and how we could achieve that. And where we've come now is a similar location, but a lot more defined. So we know how to get where we want to go. We've got a better understanding of, the different customer types and how we can hit more than one at the same time without stretching ourselves too thin. They helped us identify where we were lacking, what areas did we have gaps in, like our team structure. We need to go off and hire someone who can do X, Y, Z for us. How do we actually get that person? And did we know we needed them before? No, not really. But now we've, making those steps towards that kind of hire and that kind of growth. We even pivoted some of our business models. So we launched our new subscription service and our new revenue raise, the way we bring revenue in through some of the learnings from CSIRO. And we can now successfully say we're selling that quite quickly, which has been exciting. So not just a one-off purchase anymore. We've actually got a continuous income coming in, and through that, we have been able to develop additional value adds and being able to talk about things like value adds. That's something I never would have said, just 8 months ago.
So it really is like a business degree, hey?
It really is. It's strange, and I didn't know what TAM, SAM, SOMs were before, but now I do. So, and
they're now rolling off the tongue,
Exactly. I can talk about it. It's been quite interesting journey through that kind of discovery, and we had some fantastic, even in the early stages, some fantastic coaches and mentors come around and talk to us back in the boot camp stages, the very, very early point where they went, oh, have you thought about like leveraging it this way? And we went, well, we kind of do that, which is like a platform. So can Care Window provide other people's products? You don't have to develop them. Can you find someone else's product to put on your platform? Can you be the entrance point for aged care, for other innovations? Oh, wait, we can. In fact, we're already doing that. We have an AI translation service. We have the seniors channel able to provide their services via Care Window. Well, what's stopping us from offering more? And so now we're looking into that a lot more.
Wow. So you're becoming a marketplace as well, hey?
We are. We're going to be like the Apple for aged care, like the iPad. No, hopefully not that many apps, otherwise it defeats the purpose. But specific things. It's been exciting. So we've come a long way. And yeah, I cannot thank the team enough. So I talk in a whole new lingo now. But the travel was a lot.
But you know what? They needed you because you're the clinical experts, right? You can have all the developers, but you need someone with aged care nursing experience, which I think is really important. I want to do a bit of a quick fire round now because, I'm really interested in skills, and we're going to quick fire round some skills that I think has really been helpful and useful for you, as a clinician and also as an entrepreneur. Who would have thought you'd like, an ex-lawyer?
Extra feather in the cap.
So tell me, what are the 3 to 5 most important skills that has really helped you in your career so far?
Flexibility, the ability to be actually flexible with different things life will throw at you, and just being able to pivot whenever they come up. Being able to be good at communicating. So not just good at talking to people, but good at writing things down, good at following up emails, good at documenting. Just really, really good, clear communication skills. I'd say confidence, but I'm not always that confident. But confidence to know that you know what you're doing. And even the confidence to say when you don't know what you're doing. That's probably one of the big ones there.
Yeah, I love that one. I haven't heard of confidence.
I'll go with those 3
before. That's good. Yeah, I like that. Share one underrated or unexpected skill that has proven valuable in your career.
The ability to ask for help. To know when you need to ask for help. So a lot of people want to do everything themselves. I think the biggest thing I can share is that you don't have to. So like with us, I know when my skill set ends, and I know when I need to ask Zach or ask one of the other team members to do something. And it's the same in my nursing career. I know where my scope ends, and I know where someone else may have better skills than I. So the ability to ask for help is a really, really important skill that people need to learn is okay.
Yeah, let's take that stigma away. It's okay to ask for help, right? We're only human after all. So,
but it is a skill because a lot of people just don't do it, and you don't naturally want to do it, especially in business.
yeah, 100%. Yeah. No, I love that one too. What about a skills prediction? What single skill do you think will increase in value and why?
Tech. Skills with tech literacy, basic tech literacy. Just knowing how to turn it off and on again as a step one. We can get people to just do that without asking. Would that be amazing? No, I spend a good chunk of my day every day when I'm working as the data manager in hospitals, or even when I'm working on the tech company as well, troubleshooting simple things. And I say simple, like not to be mean, but they are things that should be simple. How do I adjust this on Word, or how do I fix my spreadsheet in Excel? I can't work out why my keyboard's not working. It's not plugged in.
So is that problem solving, or is that troubleshooting, or?
It's a bit of everything. So it's a lot of people don't go looking for the answer themselves. A lot of people don't think they need to know how to do various things on tech, but the world is becoming more technologically minded. And AI is coming. Let's be honest, it's coming. So start learning tech. And I don't mean how to fix a computer. I mean how to actually use the programs you've got and how to use them in a way that you can use them. So if you've got obviously Game Window for first accessible tech, how do you make the tech work for you? How do you find the parts of tech that you can use and use those well? Because the amount of resources we waste on helping people with simple tech issues is huge. So being good at tech can open a lot of doors.
I'm suspecting that you're talking from a hospital and also from a aged care facility type. Yeah.
In every domain, let's be honest. Like even the kids' schooling, like they come through, they need to have a laptop for every single subject now. And then, of course, you have to know how to fix their laptop because the schools don't really help them enough. Yeah. So it's starting younger and younger. They need to know how to use tech. And I mean, they call the younger generation the digital natives. So they're going to be good at tech.
Oh, no, they're teaching you now, Fiona.
Yeah.
Your kids are going to be teaching you soon.
Yeah. I remember getting a new TV a few years ago, and I came with this tiny weeny remote, and it had like 3 buttons. I went, how do I do? My kid was on YouTube in a day.
Yeah.
How did you do that? I haven't even worked out how to get to the menu yet, and he's on YouTube. It was crazy, but if you want to compete with them, you need to have the tech skills.
And looking ahead, what advancements or emerging tech excites you most in healthcare or the aged care industry?
I'd be amiss if I didn't use the old hashtag AI. It's the flavor of the month, or I should say year. There's just
I think it's going to be the whole decade soon.
Yeah, there's a lot coming. So I sit on a few special interest groups and advisory groups around AI in healthcare, and it's coming. And there's some really cool things it can do. So it's really exciting. I'm looking forward to it. But at the same time, you've got to be cautious with it. And I think that's what I'm really excited about seeing is how people are innovating with AI whilst still integrating it with the current systems and the cautious nature that healthcare needs. So I'm excited to see how they do it and to be part of it.
Specifically that you think is exciting in AI in healthcare?
I'll go boring and say AI documentation. So scribes. Scribes are going to be a game changer for documentation. You think about a nurse at the end of the bed doing their paperwork. It takes up so much time. Technology was meant to give us more time back with the patients. It's taken us less because to fill in a chart now takes, we may have permanent access to the chart. No longer the doctor's nicking off with the charts. You have to go find them. You've got it. You can bring it up live on your computer at any time, but entering it takes longer. There's a lot more clicks, a lot more steps. If I pick up a pen, I can write a whole bunch of numbers in a few seconds. On the computer, it takes longer. So I think being able to bring in, your AI scribes or your AI integration options with documentation, going to give you way more time back on the bedside and with the patient care.
Yeah, that makes sense. Yeah, and especially because, like, you do that and you need that every day as a registered nurse, right? I was in China last year and I went to a national park called Zhangzhaijie, which is like where James Cameron had the inspiration for Avatar, like this beautiful, national park, very hilly. And I saw this for the first time, which is a wearable exoskeleton. Have you seen those? They're robotic walkers, and pretty much like, you put them on your elbows, on your knees, and then, kind of like on your body. And they help you boost how you can walk better, climb, hike, stairs, mobility. I just think it was really cool, actually. So, yeah, unfortunately, I didn't have a chance to try it, but
Damn.
I was looking for them. I was like, oh, I really wanted to, but I did see someone on social media who was trying it, and it just looked amazing. So yeah, I'm looking forward to that.
Cool. There's all of the sci-fi stuff that's going to be fun to play with, but I'll go boring, and the thing that's going to excite me more is documentation, taking off the burden. Anything that reduces the burden is always good.
I'll tell you what, we need that too, right? It's probably more more essential right now for your actual daily work. So what's one thing you wish everyone should understand about aging and aged care?
It's not as scary as you think. That's what I'd say. It's just not as scary as you think. And
why do people think it's scary though?
Because they've got these preordained notions of what it's like in aged care based off of well out of date, I guess, opinions, like a story from grandma, who was in aged care in 1930, and this is what aged care was back then. Or it's not the same now. It's not scary. It's not something to be scared of. It's upsetting to have to move into aged care. Of course it is, but it shouldn't be scary. Don't be scared to say, again, I need help. It's not to be ashamed about. It's if you get to that point and you need the help, you need the help. If you get to that point and mum or grandma need the help, then they need the help. Don't be scared by something that may or may not be true anymore. People are so ready to accept the scary side of aged care. They're going to be fed mush. They're going to have to sit in a dirty nappy. They won't get the care they need.
Yeah. I think the media also
they're not going to get the care.
You know what I mean? Like,
so bad.
The media goes, oh, look, another old person who's been lying in bed and had bed sores and they, haven't been showered for days and, point fingers.
What they don't show you there is that old person who's been laying in bed for days, hasn't been showered, has got a couple of bed sores, actually hits, bites, kicks, punches, and screams at the carers when they come in to try to give them the care. And you're not allowed to force them. The media only shows one side of that story, or it's generally a negative light because that's what gets them the views at the end of the day.
There's always two sides to every story, isn't there? Yeah. If a listener wants to take a incremental care action for an older loved one, what's one practical step they can start today?
That's an easy segue for the last answer, to be honest. Start talking now. Talk to your family. What is important to them? Find out what's important. And if they are scared of aged care, you can make tour times. So most facilities will have a tour once a month or once every couple of months, or you can ring and make a private tour and they'll show you around. So go and see what aged care is like now. Talk to someone whose loved one is in aged care now, and talk to your loved one. What is important to you? What is important to your aging process as you're getting older? Don't call them old. They don't like that. But so as you get older, what's going to be important, and have those conversations. That's probably the step one to do. Have the conversation and make your plans. If that means going and getting your wills done, getting your power of attorneys done, your advanced care directives, as they're called now, go and do it. There are places that will do them for free. There's plenty of organizations out there that can help you and guide you into those steps. But it all comes back to having the conversation. What's going to be important when you get older? Yeah,
my parents are in their early to mid 70s now, and this is definitely something I'm very much thinking about, which is why I was very happy to have this conversation. And
do they need a care window?
What's that? Yeah. Well,
do they need a care window?
Because they're not in a residential home yet, but
they don't need it. They can have it at home too, not just aged care.
Oh, okay.
Never stop selling, right?
Yeah. Oh, that's your on innovation business degree happening.
Yep.
But yeah, but like one of the things that I've been saying, I'm like, you need to go get your will. And yeah, but you're right. Like I don't think families like to talk about it because we're talking about death and we're talking about the end. And, people don't want to think about it. And I think that's also why it's such a taboo, is because like, this topic is, it's not the happiest topic, but it's, and I think that's why people don't like talking about it. And so you kind of like, you're pushing it until you have to do something about it. So I think, as you say, we have to be proactive about this and understand what your parents want or what your loved ones want.
Absolutely. So at the end of the day, it's all about going gracefully into the quiet night, right?
And life is very short, so make sure you're constantly communicating. I'm going to call my parents straight after this call. See how they are.
Pretty much, oh yeah.
Final
I always like to
question. Oh, sorry. Final question. How can others contact you to learn more?
You can visit us at carewindow.com.au and jump on there. We've got all our information and lots of videos about us.
There you go. Well, Fiona, it's been such a fantastic conversation to have a chat with you. I have learned so much more about nurses, about nursing, about aged care, elder care, residential home, what's like, social isolation, loneliness, and I think just the whole process. Like, it's getting me to think, as I said, as I've got aging parents and who is pretty much ripe in this conversation right now, it's making me think about what I need to do in terms of my own incremental care action that I need to implement myself. So thank you so much for this great conversation. I've had delightful, chat with you, and I'm so glad to have you on the podcast and share your insights.
Thank you. Big pleasure.
How great and honest was that conversation? Fiona's story shows how powerful it is when real life family experience, clinical expertise, and technology comes together to tackle something as human as aging, loneliness, and connection. If this episode raised questions or resonated with your own experience, please do share it with someone in your life, especially someone who is also going through an aging or elder care journey with an older relative right now. These conversations is how we can shift societal mindsets, funding, and ultimately and hopefully improve outcomes. If you enjoyed this episode, please subscribe, leave us a review, and share it with 3 of your friends and network so they can enjoy it too. It takes a lot of research time and effort to put a podcast together, and I would very much appreciate it if you can support our podcast with a donation so I can cover my podcast production expenses and keep this show and our important mission of providing quality education, promoting gender equality, and highlighting the future skills and STEM career pathways. I'd like to extend a special thank you to the CSIRO On Innovation Program for their invaluable support. The On Innovation Program has played a pivotal role in helping clinicians and founders just like Fiona to bridge the gap between academic discovery and real-world impact through hands-on learning, expert mentorship, and a vibrant network. The On Innovation Program empowers deep tech founders to turn innovative ideas into practical solutions that benefit society. We're grateful for their commitment for sponsoring Australia's next generation of science-driven entrepreneurs and for sponsoring this episode of Emerging Tech Unpacked. Please contact me directly if you'd like to be like the CSIRO On Innovation Program and profile an awesome topic or guest for future podcast episodes. We're always looking for sponsorship, partnerships, and guest speaking collaborations. Visit our website to speak with me directly, emergingtechunpacked.com. We're available on audio format on Spotify and Apple Podcasts, and you can also watch us on YouTube, and we have bonus video content there. Make sure to tap that notification bell so you can be informed of the latest episode releases. We're active on social media, so make sure to subscribe, like, and follow us on our social media channels, LinkedIn, Instagram, TikTok, and Facebook, to stay updated with the latest news and content. To get in contact with me, you can find me on LinkedIn by searching for Lucy Lin, or on my website, lucy-lin.com. We welcome all feedback and will be very grateful if you can help us grow and spread the word by forwarding this episode to a friend and giving us a 5-star review. Thanks for your attention, and here's my final takeaway. Aged care doesn't have to be as scary as we imagine, especially if we start talking about the process early, we understand what our loved ones want, and we use technology thoughtfully to keep people connected rather than replace human care. And that incremental care action Fiona talked about, the one honest, intentional conversation or check-in with an older person in your life, we can do that today. In fact, I'm going to call my parents right now. My name is Lucy Lin, and thank you for listening to Emerging Tech Unpacked. I'll see you in the next episode.